Welcome back to 12 to Your Health. I'm Dr. Derek De Silva. It is estimated that 3 million Americans are living with epilepsy, with nearly 200,000 cases, new cases, diagnosed every year. It's a condition that's been both feared and stigmatized throughout history. While the fear and shame associated with epilepsy have faded, they've not vanished. Here to clear up some of the misconceptions and tell us where we are in treating epilepsy is Dr. Evan Fertig. Dr. Fertig is a neurologist and an epileptologist and co-director of the new Epilepsy Center at Jersey City Medical Center. Also with us is Kate Miller of Spotswood and her service dog, Greta. Kate is a college student living with epilepsy, and Greta is able to predict Kate's seizures. Both of you, thank you very much for joining us. Dr. Fertig, let me start with you and get to obviously the basic question is what is epilepsy? What are seizures?
Well, thank you. Epilepsy is a condition where there's a tendency to have recurrent, unprovoked seizures. Normally, a person has to have at least 2 seizures before they're diagnosed with epilepsy. Seizures are, you could think of them as mini electrical storms of the brain that temporarily disrupt normal function.
And Kate, when were you diagnosed with seizure disorder or epilepsy?
When I was 14.
And right now you are in college, you're taking medication. Where are you with this whole thing right now?
I'm currently on medications to control it, and I'm a current college student.
And Dr. Fertig, when we talk about epilepsy, who gets it? What are the risk factors for getting epilepsy?
Well, there are various causes in it at different ages. Early in life, before age 1, some of the most common causes are defects in brain structure. Mm-hmm. Later in adolescence and early adulthood, trauma becomes a more important cause. After age 50, then we begin to see strokes, brain tumors, and dementias like Alzheimer's disease become common causes.
Okay, so when we talk about it, how common is it for people that have had head injuries? And when we talk about head injuries, what are you talking about? Are you talking about a bump in the head, or are you? I mean, what do you mean by that? What is meant by head injury?
Oh, when we talk about brain injury as a risk factor for epilepsy, we're talking about significant injuries. To produce epilepsy, the head trauma is usually associated with major damage to the skull and brain. There's a depressed skull fracture. There might be blood in the brain. One thing that we don't understand is sometimes there's actually a lag between the time of the injury and the time that someone begins to have seizures.
Right. This isn't just just a bump on the head when you get up and you bump your head on a cabinet or something. This is much more severe.
These are severe injuries.
Now,
absolutely.
do we know what Kate had? I mean, do you know what happened here with you? Is there any reason?
There was no trauma or anything. I just woke up in the middle of the night one night, and it was dark, and I turned on the bathroom light, and I just fell and had a seizure.
How common is that?
Well, many times the cause of epilepsy is actually unknown, and actually about 50% of the cases is unknown, so it's not uncommon at all.
Now, talk to me about the dog. I mean, first of all, what is the role of the dog? The dog is, I'm assuming, is trained. Can you give us some background on the dog itself?
Greta is 4 years old. She's from Canine Assistance in Georgia, and she is a seizure response dog. Okay. Meaning she can help me after a seizure.
Okay. Now, is she able to tell you when a seizure is coming on, or is she there for after the seizure?
Both. Greta's special in that she can actually sense my seizures.
Okay.
Not all the dogs can do that, but she can sense my seizures.
And then what does she do?
To alert me,
yes,
she will hit my hand with her nose.
All right.
And if I don't listen to her, she'll stand really close to me and won't let me walk. And then if I really don't listen to her, she just won't let me walk anymore.
Really?
Yeah.
How often do you have a seizure? Are you still having seizures?
I haven't had a seizure in probably almost 9 months.
Okay, good.
So, yeah.
And then after you have a seizure, what does Greta do?
She lays on me until I come out of it.
Mm-hmm. And then what is it that you can do? I mean, is there something that you need to respond to? How does this whole thing work?
Right after she alerts me, I try to get help. I'll find somebody to help me.
Okay.
But if I'm unable to get help, she will actually go find somebody for me.
Wow, that is absolutely amazing. Is this something that we see? I mean, is this common all over the country? I mean, is the canine assistance all over the country?
I don't know about canine assistance, but I do know that many patients do have seizure response dogs. And as an epileptologist, this has actually this has actually come to our attention. And many other physicians like myself feel that it deserves further scientific scrutiny, because there's clearly something there that they obviously help patients.
Yeah, well, I mean, I know animals are able to sense a lot of things. For example, during the tsunami, there were virtually no animals that were killed, and they sensed the shaking of the earth and what was coming. So clearly, animals have a sense that we don't have as humans, and they're able to predict these things. I mean, there's no question that obviously, Kate, you know that, you sense that. What is your relationship with this wonderful animal of yours?
It's amazing. She's my best friend.
And she's with you all the time?
All the time.
Sleeps with you, goes to class with you, the whole deal?
I'm never separated from her.
Really?
Yeah.
That is absolutely amazing. Absolutely amazing. What's new in the field of epilepsy, Dr. Fertig? I mean, what do we see down the road? Cures, treatments, where are we?
Oh, this has been a very exciting decade for epilepsy treatment. We've had many new medications that come to the market for treatment of our patients. There have been 2 new medications even this year. Also, there have been advances in the imaging of the brain and electrical testing of the brain, and that's allowed us to more precisely pinpoint the origin of seizures. And when someone has seizures that don't respond to medication, that allows us to perform surgery safely.
That is absolutely awesome. This is an amazing story. I mean, good luck, by the way, good luck in college.
Thanks.
Good luck to you. Keep up the good work, and good luck with what you told me you're going to do with college. So,
yeah.
And again, and best wishes to you. And again, Dr. Fertig, thank you very much for all the great work that you do. Thank you both of you for being here. And once again, folks, our thanks to Dr. Evan Fertig and Kate Miller, and we can't forget Greta also. Stay with us. When we come back, I'll answer your email questions. But first, here's a look at this week's Community Health Calendar.